Assalamualaikum. Today I will present about using radionuclide imaging to diagnose and monitor bone disorder. So there is summary of what I will be talking today. Number 1, abstract, introduction, literature review and conclusion. Radionuclide imaging has surfaced to be a critical component in the diagnosis and monitoring of bone disorder. Radionuclide imaging and bone scintigraphy of the bone in particular has fundamentally become one of the most crucial imaging methods in the diagnosis and the follow-up of various lesions of the bone. This imaging technique is relied upon as it produces images based on the pharmacokinetics of the administered radiopharmaceuticals, which concentrate in the bone tissue. This allows visualization of bone metabolism and pathological changes if present. It is particularly sensitive to a wide range of diseases or deformities that alter bone metabolism and includes many alterations that do not get covered through normal imaging. The most essential part of bone disease is identifying and responding to them because of their deep impact on the rest of the body, even when they do not manifest. It is especially useful in patients with systemic alterations to the skeleton or in those with multiple sites of involvement, as these are usually found in metastatic bone cancers. Compared to ordinary imaging methods, radionuclide imaging is much advantageous. It can reveal changes in metabolic activity prior to the detection of any changes in the structure of bone tissue, which can enhance diagnosis. Furthermore, bone scintigraphy allows for the image of the entire body, thus aiding in the diagnosis of multifocal or systemic bone disease, which cannot be diagnosed using localized imaging techniques. Objective is to analyze the use of radionuclide imaging in various bone conditions, focusing on its advantages. The methodology used is gathering comprehensive data and insights from existing studies on radionuclide imaging. Radionuclide bone imaging is not specific, but its excellent sensitivity makes it useful in screening for many pathologic conditions. Moreover, some conditions that are not clearly depicted on anatomic image can be diagnosed with bone scintigraphy. Most fractures are scintigraphically detectable within 24 hours, although in elderly patients with osteopenia, further imaging at a later time is sometimes indicated. Athletic individuals are prone to musculoskeletal trauma, and radionuclide bone imaging is useful for identifying pathologic conditions such as plantar fasciitis, stress fracture, shin splints, and spondylosis, for which radiograph may be non-diagnostic. A combination of focal hypofusion, focal hyperemia, and focally increased bone uptake is virtually diagnostic for osteomyelitis in patients with non-violated bone. Bone scintigraphy is also useful for evaluating disease extent in Paget disease and for localizing avascular necrosis in patients with negative radiograph. Nuclear medicine studies used in the workup of osteomyelitis include three-phase bone, 67 gallium, and labeled leukocyte scintigraphy. Three-phase bone scintigraphy is the radionuclide procedure of choice for diagnosing osteomyelitis in bones not affected by underlying conditions. Bone scan abnormalities reflect the rate of new bone formation in general and consequently fractures. Orthopedic hardware or the neuropathic joint can yield a positive three-phase bone scan. In these situations, the bone scan, because of decreased specificity, is less useful. Many of the patients who are referred for nuclear medicine evaluation of osteomyelitis present with underlying bone conditions, and much effort has been devoted to improving the specificity of the radionuclide diagnosis of complicated osteomyelitis. So, radionuclide bone imaging, particularly bone scintigraphy, demonstrates high sensitivity in detecting bone pathologies. It is especially effective in identifying conditions such as plantar fasciitis, stress fractures, shin splints, and spondylosis, where radiograph may not provide conclusive results. The ability to detect metabolic changes before structural alteration become apparent on conventional radiograph allows for earlier diagnosis and intervention. Radionuclide imaging plays a crucial role in differentiating between various bone conditions. For instance, in case of suspected osteomyelitis, a combination of focal hyperfusion, hyperemia, and increased bone uptake on scintigraphy is virtually diagnostic, even when radiographs are non-diagnostic. This specificity aids in distinguishing infectious process from other causes of bone pain or abnormalities. Radionuclide imaging is routinely used to evaluate patients suspected of having musculoskeletal infections. It offers valuable information in diagnosing conditions like osteomyelitis, where early detection is crucial for effective management. Traditional imaging methods may not detect early infections changes, highlighting the importance of radionuclide techniques in such scenarios. So from there we can conclude that radionuclide imaging offers significant advantages over traditional imaging methods in diagnosing and monitoring bone disorders. Its high sensitivity, ability to provide comprehensive skeletal assessments, and effectiveness in differentiating various bone conditions make it invaluable tool in clinical practice. The incorporation of radionuclide imaging into diagnostic protocols enhance early detection, accurate diagnosis, and effective monitoring of treatment response in bone-related pathologies. So that's all for my slide. Thank you.